When an issue arises, this is when you speak on behalf of an individual, group, or cause, and you're persuading someone with the authority to solve the issue to do so. This is the advocate role. So this is when an issue arises and you speak on behalf of an individual, group, or cause, and you're trying to persuade someone with authority to solve the issue to do so. For instance, the provider is about to take the patient's blood pressure on an arm where they have an intravenous port. They cannot have their blood pressure taken on that arm. This is the example given in the NCIHC guidance document about interpreter advocacy in healthcare. Now, you tell the provider, you just inform them. This is the interpreter speaking. The patient has been instructed not to allow anyone to take their blood pressure on their left arm. But for some odd reason, they ignore you, and they continue pumping the blood pressure cuff anyways. That, as of this point, is not the advocate role, because you're not persuading anyone with the authority to solve that problem to do so. If you yell, now, not saying you should yell during an interpreting assignment, but if you say to the provider as they begin pumping the blood pressure cuff, "Stop, do not take the blood pressure of that patient on their left arm. That will result in harm to the patient." That is an example of the advocate role, because you are switching into a position of persuasiveness. You're trying to convince them not to do the thing. And in this case, your tone has a lot to do with that convincing aspect of it. But just informing them that the problem exists does not mean that you're engaging in advocacy.